Miss Barb.
Hello.
How are you?
I'm good.
All right. Have a seat.
Okay.
So what meds are you taking?
Well, I brought them all with me.
Okay. I got a whole bag. Do you know what these are for?
No.
Okay. We're going to go over all of your meds, okay? I see that you're also placed on insulin. Okay. Do you know how to check your blood pressure?
Yeah. Put that thing on your arm. That thing.
Yes. Okay, well, let me show you how to use it. Do you
Oh,
have
there's
one at
one more.
home? Do you have one at home?
No.
No? Okay, you need to buy a blood pressure machine and you need to buy a glucometer to be checking your blood sugars, okay?
Okay.
You need to be checking. So what we're gonna do you know what your medicines are for?
Some of them.
Okay.
But a bunch of them are new.
Okay. What doctors are you seeing?
I have my primary care doctor, and now I have a cardiologist, and I have the endocrinologist.
So do they all know what method you're taking?
I don't know. They're in different buildings.
Okay, so I'm assuming they're not. So I'm gonna make you a list. I'm gonna build you a list. Then we're gonna go over what each and every one is for. Okay?
Okay.
All right. So how you check your blood pressure is you see where the line is at. You're gonna put it right where your little dim is,
Okay.
and wrap it around your arm. And then you press for your blood pressure. Okay?
Okay.
Let you relax. You just relax. Breathe normal. Always check your blood sugar, your blood pressure in the mornings and at night. Always and write it down. I will give you some papers so that way you can be monitoring your blood pressure and your heart rate and your blood sugars. Okay?
Okay.
Check it in the morning. Once you wake up, get up and move it and everything. Go sit down in the chair. Both feet down on your floor. Don't cross your legs. And then check your blood pressure. Check your blood sugar while you're at it. So it's 122/63. That is very good. So when you write it down on your paper, you'll down your blood pressure and your pulse. The lisinopril and your carvedilol. Both of these, they are the ones that
Keep
the
my blood
target.
pressure low.
Yes, exactly. So do you know what signs are indicating that your blood pressure is low?
No.
So lightheadedness,
Okay.
feeling weak, feeling dizziness, those are all signs of low blood pressure. Okay? So we're gonna need so rosuvastatin is for your cholesterol. That's the most important is to take it at night. Okay? Metformin, this is 2 times a day. This is for your blood sugar.
Okay.
Make sure you take this one in the morning and at night. Okay? That is, you know what signs and symptoms you will have if you have low blood sugar?
I get real faint feeling.
Yes, sweaty, cold sweats. You'll also feel like you're gonna weakness. So make sure you watch out for those. Okay, you start shaking also. Then you're also on Plavix. It's a blood thinner. This one is very important. So whenever you brush your teeth, you have to brush your teeth with soft toothbrush. Okay.
Okay.
Watch out for any bruises that are not intentional. Like if you're noticing just bruises and you haven't hit it yourself, you really need to call the doctor. Okay.
Okay.
Pantoprazole. This one helps the juices in your stomach, so that way you don't have acid reflux. And then because you're taking so many medicines, it just protects the lining of your stomach. Okay.
Okay.
You're also on aspirin. Make sure you take this baby aspirin. This goes with the Plavix, so make sure and watch out on upset stomach or
For the bleeding.
or the bleeding. Okay, because they will both be bleeding. Do you know how to give yourself insulin? You're supposed to use 20 units of insulin. Do you know how to pull it out, draw it up, and give it to you?
They showed me.
Okay.
Kind of.
Show me. Can you please show me?
Okay.
Okay.
So
So make sure, before you draw up, make sure always grab an alcohol pad, clean it,
Okay.
upside down. There you go. Oh, sorry. And remember, you can always clean your belly, put it in your belly areas, if you can fit in your arms or both arms, anywhere where you have fatty tissue, you can. Okay,
20.
good. And then you put it in your belly.
Clean first.
Yes.
Little piece of belly.
Uh-huh.
Rub.
Uh-huh.
Inject.
Perfect. Yes, ma'am. Good job. All right. I'm gonna see you in 2 weeks. See how well you understood everything, and then I'll have also a chart for you. Okay? I made a chart for you to take home with you. When to notify the doctors and everything. We'll see how you do. Okay?
Okay.
How did it go?
It went well. I kept track.
Holy Toledo! Did you happen to call the doctor at any of these times?
No.
Blood pressure was 152 over 76. Pulse is 77. That's okay. Blood sugar is 350. Did you check your? Have you been checking your blood sugar? Have you
Yes.
been taking your insulin?
Yeah. I probably had some cake.
Okay, we're really gonna have to work on that. Okay. Okay. I made a list for you. Your name of your medications. What is your dosage? What times you need to take it at, okay?
Okay.
What is the purpose of them? Each one, carvedilol to decrease the blood pressure and the pulse. Lisinopril decreases the blood pressure. Metformin, all of this is right here. What is the purpose? What foods to avoid? And main thing, you need to hold it is 100 or less. Then you need to call your doctor, okay? That one and lisinopril, both. Both on metformin and insulin. You need to notify the doctor if you have low blood pressure readings, okay?
Okay.
We already went over with the Plavix. All right, show me that you know how to take your blood pressure. Here you go. Now, did you notify your primary doctor over what medication changes that your cardiologist did?
No, don't they talk to each other?
Okay, no, they don't necessarily. So this list is gonna help out so that way every time you go to whatever doctor you go to, either take your pill bottles or take this medication list with you, okay?
Okay.
Always notify them. And you have to be how? Sitting down, crossing your feet?
Feet out flat on the floor in the morning after I've been up and around.
Correct. And you've been checking it at night as well, I see.
Yes.
Blood sugars have been a little uncontrolled, but now it's 99. So I'm very proud of you. Okay. Blood pressure, we've been ranging a little lower in the nighttime, and it's higher in the daytime. We need to you need to make a follow-up appointment with the doctor, with your primary doctor, so that way she can see. Maybe we can rearrange your medications, or possibly. Okay.
Okay.
All
I have an
right.
appointment in a couple weeks.
Okay, perfect. Do you understand so far of what you need to do? 131 over 75 and a pulse of 65. Good job.
Okay.
We're doing good. All right. Well, do you have any questions?
No, ma'am.
Okay. Well, we will. I'll let you see your doctor in 2 weeks.